Dr. Ishiwatari, I'd like to ask you about the treatment of gastric cancer, and then I would like to talk to Dr. Tanaka about progressive gallbladder cancer. First of all, could you tell me how you measure the temperature of the lesion? There are two main methods of temperature measurement used, depending on the affected site to be heated. First, if the affected site is on the gastric membrane, a thermal sensor is attached to a tube called a gastric catheter and then guided to the stomach through the nasal cavity. This sensor measures the temperature of the gastric cavity. Second, when treating an intra-abdominal lesion, a thermal sensor is directly inserted through the abdominal wall into the tumor to measure the temperature of the lesion. In this case, a 19-gauge ultrasonic guiding tube or 21-gauge alaster needle is used as a guide for inserting the thermal sensor. Recently, a special closed-in catheter with a motor at its tip has become available, and we are now using this device. In addition, we use a thermal sensor that can measure the temperature at 3 locations at 1 centimeter intervals from the sensor tip. The temperature is also measured at the ventromedial position as well as in the oral cavity. In other words, the temperature is measured at 5 locations each time. Are there any special techniques you use when the temperature cannot be easily elevated? Well, first we have to verify that the sensor has been properly inserted into the target position. Once we have confirmed the location, we check that there is no backward blood flow by using a conventional elaster needle that incorporates an open-end catheter. In this case, the temperature may be stabilized if the sensor is reinserted at a different position. Recently, however, the number of patients with thick subcutaneous fat has been increasing, and the temperature sometimes does not easily rise in these patients. In such cases, the abdominal area of these patients is pre-cooled beforehand. In addition, there are the so-called edge effects. In such cases, we use a commercially available overlay bolus, and the results are generally good. What is the target temperature and how long is the heat applied? The heating time is 40 minutes in general. The target temperature is greater than 42 degrees Celsius. We begin timing the 40-minute treatment when the target temperature is reached. How about combined therapy? For gastric cancer cases, chemotherapy is the only therapy that can be combined with thermotherapy, generally speaking. Usually, we use mitomycin C, 5-FU, and cisplatin CDDP or its derivatives. Thermotherapy is performed once a week, and the selectin agent is dissolved into 200 to 250 cc of electrolyte solution and administered to the patient during thermotherapy by drip infusion, which is adjusted so that administration is completed within 40 minutes. For gallbladder cancer cases, radiotherapy is used together with thermotherapy in principle. In radiotherapy, a super high-pressure X-ray device called a RENAC is used to apply 1.8 to 2 grade dose of radiation to the patient at each treatment. Normally, this treatment scheme is repeated 5 times a week, that is, every weekday. About 30 minutes before each thermotherapy treatment, the patient is subjected to 2 grade dose of radiation. For chemotherapy, methotrexate A is injected intravenously about 2 to 3 hours before thermotherapy, and 5-FU is administered by intravenous drip infusion during thermotherapy. What results have you achieved with these treatments? 16 patients have undergone thermochemotherapy for gastric cancer. As you can see from this table, the lesions have been classified into two types: primary lesions, of which there have been 5 cases, and metastasis lesions, of which there have been 11 cases. Of the 16 cases, 8 were judged to have been shown effective local results, in other words, partial response. Autopsies were possible for 9 of the 16 cases, which included 6 cases of effective results. The histopathological findings of these effective cases showed dispersion of cancer cells distribution. Moreover, degeneration of cancer cells, hypertrophy of intravenous cells, and fibrinolysis between muscular layers were noted in comparisons with tissues that had not been heated. As for progressive gallbladder cancer, a total of 13 patients underwent the therapy, 11 women and 2 men. The ages of the patients ranged from 41 to 73, with the average age being 59 years. All these patients had progressive cancers of stage 4 or so. Of these cases, 4 patients exhibited tumor reduction of 80% or more, and 4 patients showed tumor reduction of 50 to 80%. When we calculated the period of effectiveness based on these clinical diagnoses and other results, the longest was 16 months. The longest survival period was 32 months. 6 patients lived longer than 6 months. Could you give us some symptomatic examples? This example is a case of gallbladder cancer. The patient was a 60-year-old woman, hospitalized due to fever and an abdominal tumor. A CAT scan revealed that the gallbladder wall was thick and enlarged. In addition, the tumor directly invaded the spleen. Treatment of this patient involved a total of 6 cycles of combined radiothermal therapy. She also underwent chemotherapy with methotrexate and 5-FU. A CAT scan immediately after treatment showed that the gallbladder wall was noticeably thinner after treatment. A CAT scan performed 6 months after the final treatment showed a reduction in tumor size. This patient returned to health and led a normal life. A CAT scan performed 15 months after the treatment showed that the tumor had almost disappeared. Although she died 32 months later due to a local reoccurrence, I think the therapy was very effective because a patient with such a local progressive cancer was able to live normally for a fairly long time. Finally, could you tell me about the side effects and complications? As for the side effects of thermal chemotherapy in gastric cancer patients, there is one case of myeloid inhibition in which the WBC count was lowered. The patient recovered after a 1-week suspension of treatment. There were no other notable side effects. Although it had been reported that side effects of anti-cancer agents were aggravated due to heating, we did not find any such instances. As for gallbladder cancer, some patients complained of an unpleasant sensation in the upper abdomen. When we endoscopically examined the abdomens of 13 patients we had treated, erosion of the gastric membrane to the pylorus vestibule was found in 4 patients. Gastric ulcers were seen in 2 patients. This may have occurred because the gastric membrane was locally weakened by thermal therapy, resulting in acute erosion and ulceration. Thank you very much for speaking with us, Doctor.